DrGarimaAsati welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic osteoarthritis in the lecture series or the video series of this arthritis. So it is in English on the demand of some of my patients which are non-Hindi especially. So this video is for those non-Hindi patients especially. Friends, at first I would like to tell you what actually this osteoarthritis is. So there is a breakdown of the joint cartilage. Cartilage is the thing which combines or joins the two bones. So that gets damaged, or it also affects the underlying bone and it also gets destroyed or destructed or damaged. So this is osteoarthritis. Most common symptom of this is joint pain and stiffness of the joint. So these two are the important and prime most symptom of this osteoarthritis: joint pain and stiffness. 3.6% population gets affected with it within recent and the current data overall world. Now friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest update of my videos, and kindly see the video till the last, because in the last I'm going to explain you about some of the homeopathic medicines which can be helpful in curing this osteoarthritis. Let's begin about our topic osteoarthritis. So it is the most common variety of the arthritis among those 100 varieties, and female get more commonly affected from this osteoarthritis. Now friends, I would like to tell you about the symptoms of this osteoarthritis. So the first and the foremost prime important symptom is pain with the disability in the movement. There is a stiffness of the joints. He or she is unable to move his or her finger. Along with that, pain gets worsened after prolonged exercise and it gets relieved after rest. The most common symptom and the most important symptom of stiffness, it mainly occurs in the morning after a prolonged inactive period. Means person has taken rest whole night, so in morning this stiffness is more. But as soon as person starts doing his daily activities, so after an hour or half an hour, this stiffness gets ameliorated and gets decreased. So there are two things: after a prolonged inactive period there is stiffness and it is more, and after a strenuous work, a prolonged period of exercise or strenuous work, it can also lead to this stiffness and excruciating pain. A crackling noise, a crepitus, is produced when a person moves his affected joint, whether it is shoulder joint, knee joint or any other joint. So the affected joint movement causes a sound, that is a crackling sound, and termed as crepitus. There is also locking of joint, means person is unable to move his joints. There is joint inability, and because of that daily routine activities gets affected, and pain gets aggravated in the cold temperature. When the temperature of the atmosphere lowers down, barometric pressure lowers down, so it increases this pain. In this, gaits get affected and it mainly occurs in the obese person. All the joints, big joints as well as small joints, gets affected. That is head, neck joint, and this shoulder joint, hand joint, wrist, and as well as this hip joint, knee joint, ankle joint, all gets affected. And this osteoarthritis causes effusion within the joint. If it is knee gets affected, then there is effusion within the knee. Smaller joints gets also affected. This is proximal interphalangeal joint, and next one is the distal interphalangeal joint. So the proximal joint, if gets affected, there is hard bony enlargement takes place, and that is termed as Haberden's knot. And if the hard bony enlargement takes place at distal phalangeal joint or distal interphalangeal joint, then it is termed as Butcher's nodes. It can be painful or painless, but it limits the movement of the joints. It restricts the movement of the finger joints. Now, this is a degenerative process, degenerative joint disease, in which cartilage loss occurs. There is a damage to the joint tissues too. Matrix of this joints, it gets affected and disorganized. There is proteoglycans present which reduces or decreases, and because of that collagen fiber gets destroyed, and because of that there is effusion of fluid within it. So the fluid gets increased in these joints. But why the distance reduces between the joints? It is because they become less mineralized and there is complete destruction or partial destruction of the ligaments, and they get fibrosed. Some osteophytes and spurs get produced, and it form bony cysts too. So the joints become swollen. Knee joint becomes swollen because of this effusion as well as bony cyst which forms there. If toe gets affected, their bony bump gets produced, and it is termed as bunions. And it mainly involves one side of the joint. One side of the body gets affected. Along with that, there is tingling or numbness of the arms and legs too. Now friends, I would like to tell you about the risk factors of this osteoarthritis. Due to any mechanical injury, any major accident occurred years ago, the loss of strength within the muscles, as well as excessive body weight, it increases the risk factor for this osteoarthritis. There may be misalignment of the two bones. They are not aligned symmetrically because of the previous any chronic injury or accident. So self-healing occurred, but there is misalignment in the two bones. So it leads to this osteoarthritis. Some calcaneal spurs or some osteophytes or bony spurs may produce respectively. Heavy exercise post-menopausal female can also show this osteoarthritis very soon. Heavy weight lifting, climbing task, heavy climbing, more climbing task, and it may be congenital or genetic predisposition may be there. Persons who are suffering from diabetes can also have this as risk factor. Inflammatory diseases, previous accidents, and some of the joint infections may also lead to this osteoarthritis. Now I would like to tell you about the diagnosis of this osteoarthritis. So it is history based or clinical based. X-ray can be done for visualizing this narrow space of the joints. Some CT scan or MRI can be done for visualizing the sclerosis of the bone. Now friends, I would like to tell you about the management of this osteoarthritis. Weight loss and moderate exercise should be done as its management. Now I would like to tell you about the homeopathic cause of this osteoarthritis. As bone gets affected, so esteem gets affected, that is self-worth. So there is a self-worth conflict is there along with it. Now friends, I would like to tell you about one of my cured case of osteoarthritis with homeopathy. A patient, that is male patient, suffering from this osteoarthritis, having age of 75 years and having all the symptoms of the osteoarthritis, and it is of knee. His knee was affected. There was too much swelling, redness, hot and tender, unable to move, and he was completely on bed. He was too much restless. In spite of that, he was unable to move, and there were red spots overall on the skin, and these were burning spots. It was sensitive to touch and can't stay in bed for a long time. He has to move because he was too much restless. After taking his whole history, we got some physical generals like he desires cold food and drink, desires too much milk, and he was a thirsty person. There was a bitter taste in his mouth. In his mental generals, he was quarrelsome. Too much quarrelsome and can quarrel without any reason, can beat children without any reason, does not like children at home. He was too much irritable and can't bear to talk. Indifference to children, restless and startling from slightest noise. He has a continuous fear that he will be poisoned or he has been poisoned by someone. There is a delusion that he sees ghosts and specters here and there. So spirits and ghosts are visible to him. So the rubric taken was delusion, specters and ghosts he sees. And delusion, he has been poisoned. Along with that, the quarrelsome nature was considered, and his startling tendency was considered, and Kali iodum, that is Kali iodatum or iodum, 200 was given, and he got completely cured within a period of 8 months. Now I would like to tell you about some of the homeopathic medicines which can be helpful in curing this osteoarthritis. So the first medicine is silesia. In this, bone feels as if bruised. So there is a bruising sensation in overall joints. Along with that, limbs feel heavy. There is a sensation as if lead has been filled within the limbs. In the hip region, there is separating sensation. Knees are tightly bound. He feels like that. Along with that, in the night, he can't sleep. And about the mental general, so the patient is too much obstinate and wants a good image. Always think what other people will think about him. So there is a fear of getting failed in any situation or condition or in any exam. There is a public apprehension because of that. So in such cases, the silesia can be helpful. Next medicine is Calcarea silicata. So there is excruciating pain in it. So all the joints are having this excruciating pain, and the person is too much emaciated, and the pain comes on suddenly and goes suddenly. He is sensitive to all impressions, all external impressions, that is sensitive to noise, touch, and there is a fear or dread of being touched. He does not want anybody to touch him, and there is an insecure feeling constantly. There is a fear of poverty. After that, he squanders money a lot, and he feels that there are a lot of expectation on him and he has to fill it. So that he becomes in a constant pressure of debt. So such cases can be cured with this Calcarea silicata. Next medicine is aurum metallicum. So there is numbness in the limbs and he feels that blood is boiling in the veins. So blood is boiling is the key feature in this. There is a tottering gait and limbs feel as if paralyzed. There is redness of the toes, especially toes gets affected, excruciating pain, and along with that there is a fear of salvation. He feels that he has committed a crime, and because of that he becomes guilty and feel himself as a criminal. There is loathing of life because of that. So in such cases, this aurum-met can be helpful. Next medicine is fluoric acid. So there is stitching like pain and there is edematous swelling. Along with that, there is burning and he wants to uncover at night. And the person is too much flirtatious, coquettish, and he forms and break relation very easily. He is having aversion to family members, indifference to relationships, and along with that, he is too much lascivious and lustful. So these symptoms may help us to cure such kind of constitutions suffering from osteoarthritis, and this fluoric acid will be helpful in such cases. And the last medicine is mug salt. So there is pain as if bones are broken. There is ulcerations within the bone and cold, clammy sweat. Pain in the periosteum of the bone. Periosteum is the covering of the bone, and pain is in that. And patient feels as knees are larger than earlier. So in such cases, this mug salt can be helpful. But what about the mental generals of this mug salt? So patient feels that he has been dominated or suppressed by some dictatorial authority. So he has only two options, either to revolt or just escape from that situation and run away. So maximum cases, this person, this mug constitution revolts back, and he feels that everyone is his enemy. He will be poisoned by anyone, and he has aversion to everyone. And he is a very quarrelsome, dominating, dictatorial and rebellious constitution. So in such cases, this mug salt can be helpful. That's all for today. We'll meet soon with a new topic in this arthritis series. And kindly don't forget to subscribe my channel. Tap the bell icon to get the latest update of my videos. And kindly see this description link for more of my video description, and stay connected to stay healthy. Thanks for watching.